Welcome to our Policy 101 video on accumulator adjustment programs. This is a term that may sound very wonky, but our goal is to break it down into ways that are very easy for you to understand. So the reason we're talking about this today is because this is one of our top priorities, our top legislative priorities for the advocacy program for the Arthritis Foundation. And it's a wonky word that really has a very simple meaning, which is that it's a program that prevents your copay assistance from counting towards your out-of-pocket spending on prescription drugs. This is something that we've seen grow as a program in the last few years, and that is why it's such a high priority for us. So basically, if you're in an accumulator adjustment program, you are spending copay assistance. It could be manufacturer assistance or it could be third-party assistance to help pay for your prescription drugs. That could be towards your deductible, it could be towards your copay or co-insurance. And all along, you've been thinking that this money has been counting towards your out-of-pocket spending, but really it hasn't. Oftentimes, what happens is people don't know that they're in one of these programs until they get to the pharmacy counter and realize that they are on the hook for the full cost of their medication because that copay assistance that they've been using has not been counting towards their out-of-pocket all this time. And when they reach the end of that copay assistance, they're now on the hook for their full out-of-pocket. Let's walk through an example to make this a little clearer. So it's the start of a new health plan year in January, and you're on a biologic medication. Let's say it costs $3,000 a month. You use a copay card at the pharmacy to help pay your copay. With the copay assistance, you may be paying as little as $5 or even $0, or perhaps a little bit more, but either way, it's a manageable amount of dollars for your copay. Let's say March arrives. You've reached the limit on your copay assistance card. Most copay cards do have eligibility limits. And let's say in this case, it's $9,000 per year. Of course, this varies with copay card, but this is just for example purposes. As a result, you've gone through January, you've used up that 3,000. You've gone through February, you've used up that the next 3,000. And then in March, you've used up the final 3,000 for that copay. Your copay card is exhausted. However, your full deductible is still out there, outstanding in full. So when you go to refill your prescription in April, you're going to owe the full cost of your drug until you reach your either deductible or out of pocket maximum. Part of the issue with this is that you may not be expecting that. And some of the data that we've collected through surveys and focus groups and other conversations with patients is that that can have a real impact on your ability to actually fill your prescription. Most of us don't have that kind of money lying around. And when we asked patients, 84% said that a large unexpected charge like that would impact their overall budget. And specifically, when we asked how, many of you said that you wouldn't fill your prescription at all, or that you would call your doctor and ask to be switched to another medication, or that you would delay your prescription fill. All of those are things that we don't want to happen. We want to make sure that you're able to stay on your medication and that you are not blindsided by a large unexpected charge. We know too from recent surveys that employer-sponsored plans are starting to use more of these kinds of programs to help control their specialty drug spend. It may be that they're not aware of the type of impact it could have on you. So one thing we always advocate is to talk to your employer about things like this that may be happening. We also encourage patients to look through their health plan materials and do keyword searches for things like accumulator or copay card to see if there are restrictions on how copay cards can be used in your health plan. Part of the problem is that these are difficult terms or programs to sort of connect with. So what we want to do is help you to connect what may be happening with your health plan to the actual policy. And then we have, of course, a whole suite of advocacy tools to help you fight this. So this is our position. We want copay assistance to count towards your out-of-pocket max. And therefore, we invite you to stay connected with us through advocacy in action and other ways to see what legislative opportunities may come your way. Most importantly, we need your stories. If you have experienced one of these or you think you might be in a accumulator program, we encourage you to story bank with us. The link is here. And these stories really are impactful for us as we're advocating on your behalf. Legislators always want to know, what is the impact to patients? We need your stories in order to tell them. So please stay connected with us and tell us your story. Contact us at advocacy@arthritis.org.